I'm Phil Rainier, Vice President of Communication and Strategy at Premier Health. In today's Premier Perspectives, I want to introduce you to another one of our valued providers. Her name is Beth Lau, and she's a lead provider in Topeka at the University of Kansas Health System St. Francis Urgent Care. She's a physician assistant, and she is joining me today, taking time out of her busy schedule. Beth, thank you very much.
Thank you very much, Phil. Glad to be here.
What do you think is the most important part of creating a special patient journey as a provider?
Yeah, I think it starts when you enter the room. So, I leave kind of whatever chaos is happening at the provider's desk, and I come into the room positive, uplifting. I introduce myself. I say, "Hi, my name is Beth Lau. I'm a physician assistant. I'm happy you're here." I try to really validate their feelings as to why they're there. Sometimes the patients have a tendency to minimize what they're going through or what they're experiencing, and I try to really, let them know that I'm appreciating them being honest and open about their symptoms, about what they've tried, what they've not tried, and their frustrations if they have any. And I really think that helps them kind of open up. And it honestly gives me a better way to diagnose and treat them because I know a little bit more about what they're experiencing as well as what's worked and not worked.
What drew you to being a advanced practice provider?
I'd say I came about it in a roundabout way. So I grew up
Mhm.
knowing that I loved science from a very young age, and I loved people. I wanted to make a difference. And so through that, I just started learning about different careers in science and landed upon actually a nutrition degree and was a dietitian before I became a physician assistant. But I realized in that for me, I didn't feel fully fulfilled. And so I wanted to be able to have a greater impact on patients. So I started exploring other professions. And so there was a physician assistant that worked with me. And so I started shadowing him after seeing what he did. And he encouraged me to go back to PA school. So I knew for me, the nurse practitioner route and the physician route were both going to take extended periods. And so I thought, you know what, I think physician assistant might be the best fit. So probably one of the hardest things I've ever done, but one of the best decisions I've ever made kind of in my career. And you had mentioned kind of the why urgent care. I like the fast pace of urgent care where I can see a patient safely and timely and have them leave kind of satisfied knowing that I, did everything I could for them. Every day is different. So, some days it's all orthopedics, other days it's all cough congestions. And so every day is just a little bit different and you're always learning. So you never reach a day that you're like, oh, today was just a regular day.
How does making a difference look in what you do every day?
A lot of times I've heard, the patient comes in and they're like, when I came in, before I came in, I was really dreading this visit. I was really, worried or concerned or in pain or whatever that they're experiencing. And then to see after the visit when they leave with a smile on their face and when they leave reviews where they say, like, this person took the time to educate me, to care about me, and to turn, that fear and worry into something that we can manage and encouraging them and letting them know they're in good hands, really makes a difference on that patient for them going forward, as well as, being seen in our clinics, but other healthcare providers in the future gives them hope for their future.